welcoming every one of us, every one of you to today's live session. Uh, First, I would like to just remind you that we have started the Acing writing master course and letter correction package. I hope that you will benefited from those things. All right, let's go and move on to our letter correction. So, this was the case notes that we had. Okay, it's a known letter. You know, a lot of you have seen the letter before, and it's a known letter. It's I have marked the informations in bold and red. These are the relevant informations. It's a very there are many relevant informations in the letter, and I've marked all of them. And okay, let's move on to the letters that you all have written. Okay, uh, the first letter has been I'm not gonna mention the name of anyone who has written the letters. The first letter I have uh, corrected as per the correction package that we are going to provide to everyone who will take the service of letter correction. The first letter we have uh, we're going to correct is this. Okay, let's start. All right. Here, Dr. William Carrison. This is the first mistake. The name of the doctor was William Carlson. So these are very much costly mistakes. Dr. William Carlson, gastroenterologist. This was not given in the address part. This is the address part you had to follow. You have to follow. It is the Dr. William Carlson, first floor, below chambers, 56 Wickham Terrace, Brisbane, 4001. Here in this part, nowhere is the word gastroenterologist mentioned. So you follow this part when you write the first portion of the letter, that is the address, everything else. Here you cannot use the word gastroenterologist if it is not written in the address portion. Okay, you write exactly what is written here. Dr. William Carlson, first floor, Bellow Chambers, 56 Wickham Terrace, Brisbane, 4001. And for each comma, you have to make a new line. Okay, for each comma, you have to make a new line. So we omit this. We have to omit this line, gastroenterologist. Okay. First floor, Barrow Chambers, everything here again. That the date has been given here. Then, dear Dr. Carson, the spelling is again mistake, has been made there is a mistake in the spelling. It should be Dr. Carlson. So, regarding Mrs. Margaret Leon, date of birth dot. After date of birth, you have to put a colon, not a dot. So date of birth colon the date of birth. I'm writing to request an assessment for Ms. Leon, a 48-year-old female who needs further investigations to rule out the diagnosis of bowel cancer. Very good introduction. In this type with this type of introduction, you can get 3 out of 3. Okay, then the writer started to write today's visit. He completely escaped the first 2 visits. Let me tell you guys, no matter how insignificant the first any visit is, you have to mention them briefly. So in this case, the first 2 visits are missing. Okay, and also at the start of this para, the date or the day of the visit has had to be mentioned, which this writer did not do. So there is a very major mistake. Now is Leon a regular patient of mine? Now there is 2 things wrong with this line. First of all, you cannot use the word patient anywhere in the letter. You cannot use the word patient anywhere in the letter. And second of all, this line is not needed. It's unnecessary because in the letter you only write the most clinical things. Everything else you don't need to mention. Has lost 19 kg weight over 5 months. It should be had lost. Any clinical finding, any complaint, any investigation finding, and any treatment of any visit should be written in past tense, and in this case past perfect tense, because this event happened before this visit. So had lost 19 kg of weight over 5 months. I have added the word the previous 5 months. Over the previous 5 months, you have to mention it. Which 5 months? The previous 5 months. She also reported. You should avoid the word also. This is informal language. So avoid also. Reported parietal bleeding after passage of stools twice in the past. She was anxious about her symptoms, which led to depression. Thus, she was prescribed Elepam. However, her overall examination was unremarkable. On which visit? You have to mention at the beginning of the para on which visit. It was, I think, it's a today's visit. Yeah, today, Mr. Ms. Leon presented with this. I think I've made myself clear. Let's move on to the next para. MS Leon's father died of colon cancer. There's a 50 years, and she thinks she has bowel cancer as well. She underwent colonoscopy 3 years ago. Again, the word ago is informal. You have to use previously. 3 years previously. This is normal. This is formal. So you omit the word ago and you write 3 years previously. Okay. Apart from borderline hypertension, she does not have any other comorbidities. Very good. Please note, she neither smokes nor does she drinks. Nor does she drinks. This is wrong. The subject verb agreement is not present here. It should be nor does she drink. Okay. Nor does she drink. These are very common mistakes, and this can reduce your marks. So you have to be mindful about those when you're writing the letter. Okay, based on the above, it would be highly appreciated if you could assess Ms. Leon's condition, perform colonoscopy if needed. Should you need further information, feel free to ask. This is informal language. You should write feel free to contact me. It is formal. You can write anything that is formal. Alright, so this letter is corrected. Now let's see how we have marked this letter. The purpose was fulfilled properly. In the introduction, the purpose has been written clearly, and when the reader who gets the letter reads the introduction can have a proper idea about why you are writing the letter. That is why this writer has got 3 out of 3 in purpose. Now content. In this part, information regarding the previous visits have been missing. Very important thing. This has reduced the mark a lot. That is why we have given 3 out of 7. Now consciousness and clarity. Clarity was overall maintained with some minimal errors. Like what? Like some things that have been written that has hampered the clarity and of this letter. That is why we have reduced the mark just to 5 out of 7. Genre style. Criteria could not be fulfilled as there are many informal words. So you get 4 out of 7. Organization and layout was overall very good. So 6 out of 7. The language, there has been many mistakes in grammar, punctuation and spelling. Like William Carrison. Okay. Like the punctuations in after date of birth that was mistaken. Like spelling mistakes and grammar mistakes. Nor does she drink and drinks, which I have mentioned already. So overall, this writer gets 24 marks out of 38, which equivalents to 315 out of 500, and ultimately this resulted in grade C. So people, that is how we mark our letters in Acing OET. It is same as the official OET personnel who mark the letter. Okay, so let's move on to this, just one sample of what we do in our letter correction. Okay, let's move on to the next letter. The next letter is same mistake. Dr. William Carrison, gastroenterologist. These two things have been written, which I have described previously. Dear Dr. Carrison. Okay, that's done. I am okay. Let's start uh, the body of the letter. I am writing this letter to refer Ms. Margaret. No, it would be Miss Leon. Miss, Miss, and the last name, not the first name. Okay. In case of adult patient, you write in this manner: Mr. or Mrs. or Miss, and the last name. And in case of children or teenagers below 16 or 17 years of age, you only use the first name. Like if this patient was 12 years old, you should have written that I am writing this letter to refer Margaret, and that is enough. Okay. Who needs assessment and investigation for bowel cancer, including colonoscopy if needed? Margaret, who is a regular patient. Again, the word patient cannot be used. Avoid the word patient. In our practice, came for, not came, visited for. Came is a an informal word and visited is a formal word. So visited for regular checkup on 6/14/6/20. She was found to be overweight and borderline hypertensive, for which she was advised exercise and weight reduction. Now the word and has been used more than once in this sentence. She was found to be overweight and borderline. Any connector, any preposition, conjunction, you cannot use more than once in a sentence. That is why the second and has been replaced by as well as. As well as. Okay. As well as weight reduction. She has a family history of bowel cancer in father. Now the writer who wrote this letter wrote just in father. Okay, in father. So you have to put in her father, who died at the age of 50 from it. Okay, she had a colonoscopy 3 years ago. Again, the word ago is informal, so we have written previously, 3 years previously, which was clear. Rather than clear, it's better to use the word normal, which was normal. Okay, she is a non-smoker and non-alcoholic. Now this is a personal history, and this personal history should have been written in a separate para, right? Personal history in a separate para. Or if you want to, if you have just one or two one information that is significant for anyone, then you write it just before the conclusion, the last, in the last para before conclusion, with, like in here, like you can here write, please note she is non, please note she is a non-smoker and non-alcoholic. Okay, so if the personal history has only one significant point, you add this in the para before conclusion at the end of the para with, like, please note she is a non-smoker and non-alcoholic. Okay, on her subsequent visit on, though she was feeling better due to weight loss and her blood pressure was also, omit also. This is informal, we have already discussed that. So omit also in normal range. However, today she has presented with history of blood in stools on 2 occasions. This should be she presented with. Okay guys, let me tell you again. In case of past visits, we will always use past tense. Okay, in case of today's visit, when you are writing about patient's complaints, examination findings, investigation findings, and managements that you have given, you have to write in past tense. Remember, and remember that always. Today she presented with history of blood and stools on 2 occasions. She was, not is, she was very anxious. Okay, she was very anxious as she believes. This is all right because she still believes that she has blood cancer, bowel cancer. So as she believes that she has bowel cancer. So in one sentence, you can use more than one tense if it is all right, or if it's grammatically correct. As a result, a comma is missing here, so I put a comma here. As a result, she has difficulty in sleeping also. This also is also informal. You write as well, or in addition, she has difficulty in sleeping. On examining, not examining, it's examination. On examination, her cardiovascular respiratory system were normal, along with no abnormalities on rectal examination. Tell LFM was prescribed, not is, it was prescribed. Was prescribed to alleviate her anxiety and help in sleeplessness. Otherwise, the letter is good, but it doesn't fulfill the criteria of a grade B letter. Now the next one, the same mistake. The name William Carrison has been written as Carlson, gastroenterologist. Okay. The next, thank you for seeing. Let's move the body. Thank you for seeing Ms. Leon, whose features are consistent with possible bowel cancer. Your further evaluation, including colonoscopy, would be immensely appreciated. Very good introduction. Initially on 16/6/20, Ms. Leon visited me for regular checkup. On examination, BP was raised and she weighed 69 kg. Therefore, exercise and weight reduction were advised to treat borderline hypertension. A review visit was scheduled. Subsequently, she made a good prognosis. She made a good prognosis. This is wrong. Should be good progress. Progress in weight reduction and blood pressure management. Today, Leon was depressed and anxious regarding two episodes of rectal bleeding. After bowel motion. Her general examination was unremarkable except her BP was 180/95. Additionally, her rectal examination revealed nothing abnormal, hence LAPAM was commenced on treating her anxiety. She does not smoke and drink. She has a positive family history of bowel cancer related to her father. The writer here has written his father. It should be her father. Her father. It's a silly mistake. Please note, she has had a clear colonoscopy 3 years ago. No, it should be 3 years previously, and it should be written like this. Please note, she had a colonoscopy 3 years previously, which was normal. This is the proper way of writing formal letter. 3 years previously, which was normal. Okay, the rest of letter is very good. This letter has very minimal mistake. Very few mistakes have been made here, and ultimately this letter can have grade B. Although these are some major mistakes. Okay, let's move on to the next one. Okay, this one. Okay, the date, very good. The date can be put at first. There's no problem in it. Dr. William Carlson. The name has been written wrong, so it is a mistake. Gastroenterologist. It is not given in the case notes, so this is another mistake. First floor, comma, below chambers. The ideal method of writing is like this. First floor, in the upper line, the comma is omitted, below chambers. 56 Wickham Terrace, Brisbane. Now, in this portion of address writing, there should not be any punctuation, there should not be any comma, and there should not be any full stop. And I think you will not forget this. And this should be written in one para. Then you will have some gap here. After this, before the dear Dr. Carlson, you have to put some gap in your letter, and there should not be any gap between these two lines and the introduction and beginning of the letter. Should not be any gap in between these. They should be adjacent to one another. No gap. Dear Dr. Carlson, regarding Margaret Leon, I am writing to refer Ms. Margaret. It should be Ms. Leon, a 48-year-old who is presenting with signs and symptoms. The writer has written who is presenting with signs and symptoms are consistent with bowel cancer. So here preposition is missing. We have put that they are consistent with bowel cancer. A further assessment including colonoscopy would be highly appreciated. No punctuation has been given here, so we have put a full stop. Next, single, she lives with her mother. This is an unnecessary information. When you are writing a letter about a mental health condition like depression or anxiety, then this information should be mentioned in the letter. Otherwise, it is not needed. Remember, anything and everything you put in the letter has to be formal and has to be relevant. Okay, because every word counts. You have to finish your letter. They say that you have to finish your letter within 180 to 200 words, and if you put all the relevant things in your letter and you omit all the irrelevant things, your letter is supposed to be in between 100 to 200 words. Okay. And she has a strong family history of bowel cancer. She does not smoke and does not drink. Another full stop is missing, so we put a full stop here. Initially on Eto Leon came, the word came is informal, so we write visited. Visited for medical checkup. On examination, BP was raised and weight was a other 3 months later. 3 months later, MS Leon feels better. This is wrong. It is a past visit. In case of past visit, you only use past tense. So 3 months later, MS Leon felt better. Although this line shouldn't have been put in here, it should have been written that 3 months later, MS Leon felt better due to weight reduction, which has been given in the case note. And again, the punctuation full stop is missing. So full stop has been given. On today's visit, she was depressed, anxious, and insomniac because of seeing blood in her bowel motion in 2 occasions. This is a wrong preposition. It should be on 2 occasions. In terms of medical examination, BP was, not is, was. The BP was 180/95. Weight was 50 kg, not is, was. Any finding of today's visit should be written in past tense. Cardiovascular and respiratory systems were normal and rectal examination shows, it's not shows, it showed no obvious signs. And again a full stop is missing. This person has forgotten to use punctuations. Okay, in view of the above, I am referring Leon for further assessment of her condition, not his. These are very silly mistakes. And again full stop is missing. Please don't hesitate to contact me. Full stop is missing. Okay, let's move on to the next letter. Okay. Okay, this is a good starting. This person had not made any mistake with the name. First floor bellow chamber. This should be in the next line. Wickham Terrace, Brisbane, 4001. Next line. I hope you guys have understood how to write address. Okay, this should be in one para. No gap in between this. No punctuation. I mean no comma or full stop in here. And for every comma in the case note in the address section, you make a new line here. Okay, the date, dear Dr. Carlson. I don't know why I think it's a mistake. Sorry, it's all right. Dear Dr. Carlson, regarding Margaret Leon. Now it should be a miss. Margaret Leon is a mistake. The marital status should be written in the name of obviously, and the name Leon has been written with small l. It should be with capital L. Leon. And the date of birth is missing. So the name, regarding the name and then the date of birth, this has to be written here. If the date of birth is given in the case note, there is no way you can miss it in your letter. If you miss the age of a person in a letter, it's not a big mistake as long as you write the date of birth properly. And if the date of birth is not given in the case note, only the age is given. In that case, you have to write the age. Okay. I am the short form. Short forms are not allowed in the formal letter. So I am writing to refer this patient. Do not use the word patient. So it's a mistake. A 45 years old. No, it is a 45-year-old. Okay, this is a noun phrase. 45-year-old woman who requires screening for colon cancer. Not colon cancer, it's bowel cancer. So it's the big mistake. Initially, comma is missing. On this date, she presented for regular checkup. Her BP, the word BP has not been written properly. It should be capital B and capital P, not capital B and small p. Capital B and capital B, and that's correct. Her BP was 160/190, pulse rate was 70, and she was overweight. The be verb is absent in the whole sentence. So her BP was 160/190, pulse rate was 70, and she was overweight. Therefore, weight reduction and exercise were advised. On review 3 months later, she had had a satisfactory progress regarding overweight and had normal vital signs. I think if you just write she made a satisfactory progress, that's good enough. There's no need to use has had or had in these situations. Remember guys, in case of OT writing, you just have to be precise and accurate. You don't have to write all kinds of sentences like ILTS. You don't have to be using complex vocabulary like ILTS. Simple vocabulary with precise writing and accurate writing is good enough to get grade B, even grade A. Although it's quite difficult to get grade A, but grade B is good enough. Okay. On today's visit, the patient, again the word patient has been used. It shouldn't be. The word patient should never be used in your letter. Was anxious and depressed after she had noticed a blood. There is no article before blood, so you omit this a. She noticed blood after bowel motions. She believes having bowel cancer. Okay. Blood pressure and pulse rate were high. The pulse rate was within normal limit. It was 100, below 100, I believe. So pulse rate was normal. So it is a misinterpretation of the case note. Remember, when you are writing about physical findings of the physical examination, you don't need to mention any normal finding. If you only write the abnormal findings, that is good enough. Or if you only write the positive findings, that is good enough. And she had lost lots of weight. This is another informal writing. Not lots of weight. If you write a lot of weight, and there is formal. So in the place of lots of weight, we write a lot of weight. While cardiovascular, respiratory, again, why are you using capital C here? You should use small c. Cardiovascular, respiratory, and rectal examination were normal. I have prescribed LAPAM. The word LAPAM is a proper noun. It is a brand name. So any proper noun should be written in capital letter. So they should be capital A, LAPAM. And I think the spelling is wrong here. Comma 15 milligram, comma, for anxiety. We have discussed about how to write drug doses previously. I will again tell this for you. When you are writing drug with doses, like omeprazole, just for example, omeprazole 20 milligram. Right? You want to write omeprazole 20 milligram twice daily. How do you write this in the letter with proper punctuation? So nothing. Twice daily. You write like this: omeprazole, comma 20 milligram twice daily, comma. Okay, I think you get that. And if it is right, it's the correct form. And if only in the case note it is given only the omeprazole 20 milligram, then in the letter you write like this: omeprazole, comma 20 milligram, comma. That's it. That is how you write drug doses with proper punctuation in your letter. Okay, where were we? Yeah, we were here. You are here. Okay, let's move on. In terms of patient history, in terms of patient's history, the word patient should not be used. She had a strong family history. It is wrong. The person here has written she had a strong family history. This is grammatically incorrect. It should be she has a strong family history. She will always have the history. It's always a present tense. So she has a strong family history of colon cancer. For that, she is doing regular checkup. Last colonoscopy was normal 3 years previously. Okay. Your urgent, the spelling is wrong. Your urgent, URGNT, not ARGNT. This is wrong. So it's a spelling mistake. Okay, please don't hesitate to contact me for information. And the full stop is missing here. Okay. So this is another letter that we have corrected. Okay, let's move on to the next one. Dr. William Carlson, fast for ballot chambers, should be 4000 on next para. Okay, then the date is given. Dear Doctor, dear Dr. Carlson, not dear Doctor. Once the name of the doctor is given, you have to mention it. Dear Doctor, the last name CARLSON. Dear Dr. Carlson. You can either use a comma here or you do not use a comma here. Both of them are correct. But if you do not use a comma in here, you cannot use a comma here after your sincerely. And if you use a comma after dear Dr. Carlson, you have to use a comma after your sincerely. I think you get it. Okay, let's move on to the body of the letter. I'm writing to refer Ms. Leon, a 40-year or single woman, a comma is missing, who needs further assessment, including a colonoscopy to rule out colorectal carcinoma. In the case note, it is written bowel cancer. So it should be bowel carcinoma, not colorectal carcinoma. This is a misinterpretation of the case note, and this is judgmental, and it can reduce your marks to a huge amount. Okay, Leon is a regular patient. Ever the patient of mine lives with her mother. She has unremarkable medical history. The person has written she has unremarkable medical history, comma, a colonoscopy performed 3 years ago showed no significant findings. This is a common error when you are linking to simple sentences, or should I say do definite clauses. Like she has unremarkable medical history is one definite clause. A colonoscopy performed, also was performed, should be was performed. It's a grammatical mistake has been made here. So a colonoscopy was performed 3 years previously. Okay, the point I was about to make is this: a colonoscopy was performed 3 years previously that showed no significant findings. These are two uh, uh, definite clauses. So when you are adding two definite clauses in a compound sentence, you have to put a connector after the comma. So it should be she has unremarkable medical history and a colonoscopy was performed. Okay, I think you get this. Okay, okay. She has a strong family history of bowel cancer again, and should be and her father died of it on 16/6/20. I think the date has been mistaken here. Should be 14/6/20. Remember, guys, don't make mistakes with dates, names, name of the procedures, diagnosis, and the treatment, because this can reduce your marks. Okay, on 14/6/20, she visited me, not came to me. Came is an informal language. Visited me for general checkup. Her medical examination was unremarkable, apart from hypertension. Try not to use the bracket in your letter as much as possible. Okay, try to use less brackets in your letter. And her medical examination was unremarkable, apart from hypertension and mild obesity. This is judgmental. In the case note, the patient was said to be overweight. The patient was not said to be obese, or no BMI was given in the case notes. So, if you write the word mild obese, this is judgmental and this can reduce a mark. So, you use exactly what has been written in the letter, like overweight. If the word overweight was not written in the letter and only the weight was given, in that case, you just had to mention the weight. Okay. I think I've made my point here. Therefore, exercise and weight reduction were advised. A review visit 3 months later showed the patient's general health had improved and her blood pressure had dropped to 140/85, and she had lost 8 kg. She lost 8 kg, not 6 kg. So there is another mistake. These are very costly mistakes. Okay. At today's consultation, Ms. Leon reported that there had been blood in the toilet bowl on 2 occasions. Her BP was 185/90, while no abnormality was detected on cardiovascular and respiratory examination. She has lost further 11 kg of weight and is very anxious, depressed, and could sleep not, because she believes that she has bowel cancer. First of all, there has been a mistake of tense here. It should be she had lost. She had lost. This is a past event. Okay. In today's visit, she is reporting about an event that has already happened. So it should be she had lost further 11 kg of weight and was very anxious, depressed, comma, and could not sleep. Not could sleep not, should be could not sleep. And could not sleep because she believes that she has bowel cancer. She still believes that she has bowel cancer, so this is right. This is right. Elepam, comma is missing, comma 15 milligram 1 tablet, comma. So this should be like this. We have already discussed how to use punctuation when writing doses. Going to bed was prescribed as a temporary measure for anxiety and insomnia. A review consultation is planned after gastroenterologist opinion. And Nebostobius is missing. Okay. I would be very grateful if you could inform me keep me informed. Okay, not keep inform me of our status. This is grammatically mistaken. So if you could inform me of our status, and also the comma should not be given here, and the if should be in small I. If in case of inquiries, please do not hesitate to contact me. Okay, we have two more letters left. Let's move on to the next letter. Okay, dear Dr. William Carlson, this. Okay, the terrace should be E. Is a mistake. Not a major one, but a mistake. And this should be in the next line. Dear Doctor, comma is missing. I should be Dear Dr. Carlson. Regarding Margaret Leon, date of birth, the colon is missing. Date of birth, colon 1872. I'm writing to refer Miss Margaret to a gastroenterologist who's I'm making it clear for you guys to see that how this writer wrote the letter. Okay. Okay. This is how the writer wrote the introduction. I'm writing to refer Miss Margaret to a gastroenterologist whose features are suggestive of bowel cancer. Now, three mistakes in this one line. Number one, it should be Miss, not Miss, it should be MS Leon. Here, there is also missing, it should be MS Leon, because we do not know for the marital status for sure, and she's an aged person. She can be divorced. So it should be MS Leon. MS Leon. To a gastroenterologist. No, you are writing to the doctor. You have written the name of the doctor here, Dr. William Carlson. So there's no need to mention again a gastroenterologist because you are already writing to him. Okay. I'm writing, so it should be I'm writing to refer Miss Leon, whose features, not whose, is another mistake, short form, and that is also been used wrongly. Whose features society of bowel cancer for further evaluation and treatment. 48 years old lady visited in my clinic on 14th of June for her blood regular checkup. When did she visit? Is it today or the day after tomorrow or 5 days previously? You have to write about when, like today, and they should not be mentioned here. It should be mentioned in the introduction. So, visited my clinic on 14. So, if you write the date like this, you should have to write 14th of July or June or whatever. This informal writing. She is single and lives with her mother. This line is not needed. Her father had died due to bowel cancer, and she also had colonoscopy 3 years back. Avoid the word also. This is informal. On examination, her blood pressure was found to be. Her blood pressure was. So B bar is absent here. Found to be on higher side. Though, the word though is informal, use something formal. She doesn't. Short forms are not allowed in formal writing and OET writing. This will decrease your mark. Does not smoke and drink. She is not known to any allergy, but her BMI is high. The word BMI has never been used in the letter. In the case notes, nowhere the BMI of the patient has been given. The weight has been given, so this cannot be written. Her weight is 50 kg. Was not given in the case notes, for which she was, not is, she was advised. Was advised to do regular exercise for reducing the weight as well as controlling the hypertension and review in 3 months. Okay, on her subsequent visit after 3 months, she was feeling better as she had lost weight and her blood pressure was within normal limits. Okay, on today's visit, officers. So she was worried that she might have colon cancer like her father. Avoid the word so. This is informal. Okay. Avoid the word so. 1 minute, guys. Okay, avoid the word so. The otherwise the paragraph is okay. The punctuation has not been used properly here. Let me highlight it for you. Okay. Otherwise the letter is good. I mean, there has been a lot of mistakes and probably a grade C. Alright, now today's last letter that we are gonna show in this live class. The introduction is good, almost. Should be okay. Date Carlson, Margaret Leon. Okay, I'm trying to refer Miss Leon. For another mistake, if you use dot after Mr. or Mrs. in one place of a letter, you use this dot everywhere. Like here, you have written MS and no dot has been given after MS, but here you are given MS dot. This will bring you negative marks. A 48-year-old, there should be like this. This is a mistake. A 48 hash year dash old woman who has a family history of bowel cancer. Your assessment including colonoscopy to rule out the possibility of bowel cancer is required. Her colonoscopy from 3 years ago was normal. In the introduction, this line, anything except the name of the patient, the personal diagnosis, and any specific request. Only these three things will have to be written in the introduction. Other than this, you cannot put any other information in the introduction. So the hair colonoscopy from 3 years ago was normal. This is wrong to put in here. You write it in any other para. Initially, she visited me in the clinic on Eto for routine checkup. Her pulse was normal, but the word but is informal. You use however. However, her BP, not small b, it is large B and large P. Okay. Her BP was measured a little above the normal range. Additionally, she was diagnosed to be overweight, for which no comma should be given in here. I advise regular exercise and a healthy diet, not a healthy diet, and healthy diet. Okay, the person will eat anything that is healthy. That is why not a healthy diet, should be healthy diet. Okay, all right, and a healthy diet. I reviewed her after 3 months on 25/9/2020. Trying to write in passive format. I reviewed her. It's an active format. Okay, so it's not wrong, but it is not very much appropriate to use active form in these letters. So try to use passive forms. Okay, so like you can write like this: that she was reviewed after 3 months. Her weight had reduced and her vitals were within normal limits. Today, patient should not be used. It's wrong. Visited me complaining, feeling sad, depressed, anxious, and having trouble sleeping. She had noticed blood in her toilet bowl on 2 occasions after bowel motion. Her BP, not large B, her BP appeared to be elevated, and a rectal examination was done which showed no abnormality. I have prescribed Elepam, comma 15 milligram, not comma. It should not be any comma here. Okay, let me correct the whole thing for you and highlight it for one last time today, so that you don't make me this mistake in your letter. Elepam 15 milligram, 1 tablet before bed, comma. Okay, this is the proper writing. Punctuation. Tolerable anxiety and sleeplessness. Otherwise, the letter is otherwise right. So a lot of mistakes in this letter, and this is another grade C plus letter. Okay, so these are some of the letters that you have written And I think I have evaluated all of the letters that we have written in the case note in the post that we gave for the letter challenge 3. And I hope that you all will be benefited very much from this session. Okay, thank you very much everyone. Thanks to everyone for attending the session. Hope that you clear your OAT easily, and goodbye for today.